There's a question I've been asked more times than I can count in my consultation room, whispered with embarrassment, typed nervously in late-night emails, and buried beneath layers of shame that have absolutely no business being there. Does masturbation cause cancer? And before you click away thinking this is just another medical myth-busting video, let me tell you something that might surprise you. The real question isn't about cancer at all. It's about control. It's about pleasure. It's about the stories we've been told since we were young about what good women do and don't do with their bodies. Stay with me until the end, because I'm going to dismantle a lie that has kept generations of women disconnected from their own bodies. And I'm going to show you the actual science behind what happens in your body when you claim ownership of your own pleasure. This isn't just about health, it's about dignity. Tell me in the comments below if you've ever been made to feel ashamed of your own body, if you've ever believed that your pleasure was somehow dangerous, or if someone ever suggested to you that wanting to feel good in your own skin was selfish or wrong. Right, I'm listening if you're ready for the truth. And if you're here because you're tired of half-truths and medical fairy tales, subscribe now, because I'm Dr. Valeria Montes, and on this channel we talk about women's health with the respect and honesty it deserves. No filters, no shame, just science and compassion in equal measure. Let me start by giving you the direct answer, the one you came here for. No. Masturbation does not cause cancer, not breast cancer, not cervical cancer, not ovarian cancer, not any kind of cancer. There is absolutely zero credible scientific evidence linking self-pleasure to malignancy. None. And I need you to hear this clearly because I know that for some of you, just reading that question triggered a flood of anxiety that you've been carrying for years, maybe decades. But here's what fascinates me as a physician who has spent years listening to women's deepest concerns about their bodies. The fact that this question even exists tells us something profound about how we've been taught to fear our own sexuality. Think about it. We don't ask if eating chocolate causes cancer with the same trembling voice. We don't wonder with the same shame if taking a hot bath will give us tumors. But when it comes to touching our own bodies for pleasure, suddenly there's this dark cloud of medical anxiety hovering over us. I want to take you back to a conversation I had 3 years ago with a patient I'll call Margaret. She was 52, educated, successful in her career, mother of 2 grown children. She came to me for a routine checkup, and at the very end of our appointment, just as she was about to leave, she turned back and asked if she could ask me something personal. Her voice dropped to almost a whisper. She wanted to know if her habit of masturbating could have caused the small, benign cyst we'd found in her breast during her mammogram. She said the word masturbating like it was a confession, like she was admitting to something criminal. When I assured her there was no connection whatsoever, she actually started crying. Not from relief, though that came later. She cried because she realized she'd been carrying this guilt for 30 years, since she was 22 years old, and her mother had walked in on her and told her that women who touch themselves that way end up sick and alone. 3 decades of pleasure tainted by fear. 3 decades of checking her breasts obsessively, not just for lumps, but for punishment. This is what shame does. It doesn't just make us feel bad. It literally alters our relationship with our own bodies, turns normal biological functions into sources of anxiety, and keeps us trapped in a prison of misinformation that someone else built for us. So let's talk about what actually happens in your body when you experience sexual pleasure, whether with a partner or alone. Because understanding the physiology is the first step toward reclaiming what should have always been yours. When you become sexually aroused, your brain releases a cascade of neurochemicals: dopamine, which is associated with pleasure and reward; oxytocin, often called the bonding hormone, which creates feelings of connection and well-being; endorphins, your body's natural painkillers. And as you reach orgasm, your brain experiences what can only be described as a full-body neural symphony. Blood flow increases throughout your entire system. Your muscles contract and release. Your breathing deepens. Your heart rate increases temporarily, and then settles into a relaxed rhythm. And here's the crucial part. All of this is normal. All of this is healthy. Your body was designed for pleasure. not as a side effect, not as a bonus feature, but as a fundamental aspect of being human and being alive. Now, let me address the cancer question from a purely clinical standpoint, because I want you to understand why this myth is not just false, but actually backwards. Regular sexual activity, including masturbation, has been associated in multiple studies with potential protective effects against certain health conditions. In men, frequent ejaculation has been linked to lower rates of prostate cancer. In women, the hormonal fluctuations and increased pelvic blood flow associated with orgasm may contribute to better reproductive health overall. But more importantly, and this is what I really want you to understand, pleasure itself is therapeutic. Chronic stress, which we know is linked to increased inflammation and potentially to various disease processes, is reduced when we allow ourselves moments of joy and release. Your nervous system needs regulation. It needs to move out of that constant state of hypervigilance that so many of us live in, and sexual pleasure, experienced safely and without shame, is one of the ways your body naturally downregulates stress. Think about what happens when you're constantly tense, constantly worried, constantly denying yourself basic comfort. Your cortisol levels stay elevated, your immune function can be compromised, your sleep suffers, your digestion struggles. You're essentially keeping your body in a state of emergency, and that state of emergency, maintained over years, is far more dangerous than any natural expression of sexuality could ever be. I had another patient, I'll call her Diana, who came to me at 58 with a litany of stress-related symptoms: insomnia, digestive issues, frequent headaches, muscle tension. We talked about her life, her responsibilities, her caregiving duties. She was stretched thin, giving to everyone, sleeping maybe 5 hours a night, and when I asked her about joy, about pleasure, about anything she did purely for herself, she looked at me like I'd spoken a foreign language. Over the course of several appointments, we talked about self-care not as bubble baths and candles, though those are fine, but as genuine permission to inhabit your own body with kindness. I specifically asked her about her intimate life. She'd been divorced for 10 years. She told me she didn't really think about that anymore. But when I normalized the conversation, when I explained that her body didn't stop needing pleasure just because she'd stopped having a partner, something shifted in her face. 6 months later, she told me that learning to reconnect with her own body, learning that it was okay to want to feel good, had changed more than just her stress levels. She slept better. Her chronic neck pain had diminished. She felt more present in her own life, and she said something I'll never forget. I didn't realize I'd been living like a guest in my own body. That's what happens when we internalize shame about our sexuality. We become guests in our own bodies, polite, careful, never taking up too much space, never asking for too much, certainly never demanding something as radical as pleasure. Now, let me ask you something. And I want you to really think about this. Where did you first learn that your pleasure was dangerous? Was it from your mother, who herself had learned it from her mother? Was it from a religious community that conflated purity with denial? Was it from a partner who felt threatened by your independence? Was it from a culture that told you good women don't want, don't ask, don't enjoy? Because here's what I've observed in 15 years of clinical practice. The women who struggle most with allowing themselves pleasure are often the same women who've spent their entire lives serving others. They've been taught that their value comes from sacrifice, from selflessness, from putting everyone else's needs before their own. And somewhere in that teaching, they absorbed the message that wanting something for themselves, especially something as supposedly frivolous as pleasure, was selfish. But let me be very clear about something. Caring for your own body, understanding your own needs, and allowing yourself to feel good is not selfish. It's foundational. You cannot pour from an empty cup, as the saying goes, but more than that, you shouldn't have to. You're not a resource to be depleted. You're a human being with needs and desires that are just as valid as anyone else's. The science on this is unambiguous. Women who have healthy relationships with their own sexuality report higher levels of life satisfaction, better mental health outcomes, and stronger immune function. This isn't because orgasms are magic, it's because when you're not at war with yourself, when you're not carrying shame about something as fundamental as your own body, you have more energy for everything else. You sleep better. You cope better with stress. You're more present in your relationships because you're not constantly monitoring yourself, judging yourself, punishing yourself. Let me tell you about the neuroscience of shame for a moment, because I think it's important to understand what's actually happening in your brain when you carry these kinds of beliefs. Shame activates the same neural circuits as physical pain. Your brain literally processes shame as a threat. And when you experience shame about sexuality, about pleasure, you're training your brain to associate something natural and healthy with danger. This creates what we call cognitive dissonance. Your body wants one thing, your brain has been taught to fear that very thing, and you end up in this exhausting internal conflict that never resolves. You might find yourself avoiding intimacy altogether, or engaging in it but feeling guilty afterward, or developing anxiety around your own body's natural responses. And here's the insidious part: that anxiety itself can manifest as physical symptoms. I've seen women develop pelvic pain, difficulty with arousal, or complete loss of desire, not because there's anything wrong with their bodies, but because the stress of shame has literally created dysfunction where none existed before. So when we talk about whether masturbation causes cancer, what we're really talking about is whether pleasure is safe. And the answer is yes, pleasure is safe, pleasure is healthy, pleasure is your birthright. But I want to go deeper than that, because I know that for some of you, the question isn't just about cancer. It's about whether you deserve to feel good. It's about whether wanting pleasure makes you somehow less than, somehow wrong, somehow broken. Let me share with you what I tell my patients when we have these conversations. Your body is not your enemy. Your desires are not character flaws. The fact that you want to feel good doesn't make you selfish or shallow or morally compromised. It makes you human. And here's something that might surprise you. The women I see who have the healthiest, most fulfilling, intimate lives, whether partnered or single, are not the ones who look a certain way or who fit some idealized standard. They're the ones who've made peace with their bodies. They're the ones who've decided that their pleasure matters. They're the ones who've stopped apologizing for taking up space in their own lives. I want to talk for a moment about what happens as we age, because I know that many of you watching this are navigating perimenopause or menopause, and you've been told, either explicitly or implicitly, that your sexual life is somehow over. That desire is something for younger women. That pleasure is something you've aged out of. This is categorically false and, frankly, insulting. Yes, your body changes. Hormonal shifts affect arousal, lubrication, sensitivity, but none of that means you stop deserving pleasure. None of that means your sexuality expires. In fact, many women report that their 50s and 60s are the most sexually satisfying decades of their lives, precisely because they've finally shed some of the performance anxiety and shame that plagued them when they were younger. But here's what you need to know. Maintaining sexual function, whether with a partner or alone, actually helps preserve it. Your body is adaptive. When you continue to experience arousal and pleasure, you're maintaining blood flow to those tissues, maintaining elasticity, maintaining sensitivity. Use it or lose it isn't just a catchy phrase, it's physiology. And this is where masturbation becomes particularly relevant for women in midlife and beyond. If you're not in a relationship, or if you're in a relationship where intimacy has become infrequent, regular self-pleasure isn't just emotionally healthy, it's physically beneficial. It helps combat vaginal atrophy. It maintains nerve sensitivity. It keeps your body responsive. But beyond the physical benefits, there's something profoundly empowering about learning or relearning to give yourself pleasure without depending on anyone else. It's a declaration of independence. It's a refusal to accept that your body is done, that your pleasure doesn't matter, that you should just quietly accept whatever diminishment society wants to impose on you. Let me ask you this. Have you ever noticed how comfortable we are talking about the ways women's bodies fail them as they age, but how uncomfortable we get talking about the ways women's bodies can still bring them joy? We'll discuss hot flashes and weight gain and thinning hair all day long, but the idea that a woman over 50 might actively enjoy sex, might seek out pleasure, might have a vibrator in her nightstand. Suddenly everyone gets squeamish. This is ageism intersecting with sexism, and it's designed to keep you small, quiet, and convinced that the best years of your life are behind you. Don't buy it. I've had women in their 70s tell me about discovering pleasure for the first time in their lives after their husbands passed away. I've had women in their 60s describe how learning to masturbate helped them heal from sexual trauma they'd been carrying since childhood. I've had women in their 50s say that finally giving themselves permission to explore their own bodies was the most revolutionary act of self-love they'd ever undertaken. These aren't rare stories. These aren't exceptions. These are simply the stories we don't tell often enough because we've been conditioned to believe that aging women's pleasure is either non-existent or irrelevant. Now, I want to address something that might be underlying this fear about masturbation causing cancer. The deep, often unconscious belief that pleasure must be paid for somehow. That if something feels good, there must be a catch. That joy always comes with a price tag. This is scarcity thinking applied to your own body, and it's remarkably common, especially among women who were raised with messaging about sacrifice and suffering being somehow noble or redemptive. The idea that you should earn good feelings, that you should suffer first, that pleasure is only acceptable as a reward for enduring pain, but your body doesn't work on a transaction basis. Pleasure doesn't deplete you. It doesn't create a debt that must be paid later. In fact, the opposite is true. Pleasure, experienced without guilt or shame, is restorative. It fills you up. It reminds your nervous system that safety and joy are possible. It counterbalances all the very real stressors and hardships of life. Think about children for a moment. Before we teach them otherwise, they're completely unself-conscious about feeling good. They dance because it feels good to move. They laugh because it feels good to laugh. They're not calculating whether they've earned the right to enjoy themselves. They just do. Somewhere between childhood and adulthood, especially for women, that unself-consciousness gets trained out of us. We learn to monitor ourselves constantly. We learn to ask permission. We learn to wait for someone else to validate our experiences before we trust them ourselves. Reclaiming your relationship with pleasure is, in many ways, reclaiming that childlike trust in your own body's signals. Not childish, but childlike, clear, direct, honest. I remember a patient I'll call Rosa who came to me with a question that initially seemed to be about hormones. She was 55, postmenopausal, experiencing low libido. She wanted to know if hormone replacement therapy might help. As we talked, it became clear that the issue wasn't primarily hormonal. She simply had no privacy, no time, no space where she felt she could relax into her own body. She had adult children who'd moved back home. She had aging parents she was helping to care for. She had a demanding job. She went from the moment she woke up until she collapsed into bed at night. We didn't start with hormones. We started with boundaries, with the radical idea that she could lock her bedroom door, that she could take 30 minutes on a Sunday afternoon for herself, that her needs mattered as much as everyone else's in her household. It took months. She pushed back at first, insisting that her family needed her, that she couldn't possibly ask them to manage without her for half an hour. But gradually, she began to see that she wasn't just burned out, she was disappearing. And part of what she'd lost was any sense of her body as a source of pleasure, rather than just a vehicle for service. When she finally gave herself permission to reconnect with her own sexuality, when she stopped treating her body like a machine that existed only to serve others, she told me it felt like coming home to herself, not just sexually, though that did improve. But in every aspect of her life, she felt more present, more grounded, more real. This is what I mean when I say that the question about masturbation and cancer isn't really about cancer. It's about permission. It's about whether you're allowed to feel good in your own skin without punishment, without payment, without apology. So let me give you some actual medical facts that might help you contextualize this conversation. The primary risk factors for cancer are things like genetics, environmental exposures, chronic inflammation, tobacco use, excessive alcohol consumption, obesity, and sedentary lifestyle. Notice what's not on that list. Sexual behavior between consenting adults, including solo sex. In fact, if we're talking about behaviors that genuinely reduce cancer risk, we'd be talking about exercise, stress reduction, adequate sleep, healthy diet, and strong social connections. And guess what? Regular sexual activity, including masturbation, can contribute to stress reduction and better sleep. So if anything, there's an argument to be made that a healthy sex life might be protective, not dangerous. But beyond the cancer question, let's talk about what masturbation actually does for women's health, because the benefits are real and documented. Regular orgasms can help with menstrual cramps by releasing endorphins and reducing uterine tension. They can improve sleep quality by releasing prolactin, which has a calming effect. They can reduce headache intensity and frequency through the same endorphin mechanism. They can improve mood by boosting dopamine and serotonin. They can strengthen pelvic floor muscles, which has implications for bladder control and sexual function. None of this is fringe science. These are well-established physiological effects that we've understood for decades. But because the topic is sexual pleasure, especially female sexual pleasure, these benefits are rarely discussed in mainstream health conversations. Imagine if there were a medication that reduced pain, improved sleep, elevated mood, and strengthened core muscles. We'd be advertising it everywhere. But when the medication is your own body's natural capacity for pleasure, suddenly we get quiet. Let me talk about something that comes up frequently in my consultations: the concern that masturbation might make partnered sex less satisfying, or that it's somehow a betrayal of a relationship. This fear is rooted in several misunderstandings about how sexuality works. First, sexual response is not a zero-sum game. Experiencing pleasure alone doesn't deplete your capacity for pleasure with a partner. In fact, women who have a healthy solo practice often report more satisfying partnered experiences because they understand their own bodies better. They know what works for them. They can communicate their needs more clearly. They're not entirely dependent on a partner to decode their pleasure. Second, maintaining your own sexual connection with yourself while in a relationship isn't betrayal, it's autonomy. You don't stop being an individual with your own needs just because you're in a partnership. And a secure partner, one who isn't threatened by your independence, understands this. But I also want to acknowledge that some of you might be in relationships where your partner does feel threatened by your sexuality, particularly your sexual autonomy. If you have a partner who monitors your body, who becomes angry or controlling when you express desire or seek pleasure independently, who treats your sexuality as something that belongs to them rather than to you, that's not love, that's control. And it's worth examining very carefully. Healthy relationships are built on mutual respect, which includes respecting each other's bodily autonomy. You can choose to share sexual experiences with your partner, but your body and your pleasure don't require anyone else's permission or approval. Now, I want to shift gears slightly and talk about something I see frequently: the way shame about sexuality can actually create the health problems we fear. Psychosomatic illness is real. When you carry chronic shame, chronic anxiety, chronic guilt, your body responds. You might develop pelvic pain with no clear physical cause. You might experience pain during intercourse that has no structural explanation. You might have difficulty with arousal or orgasm not because of any physiological problem, but because your brain has learned to associate pleasure with danger. This is what trauma does. This is what shame does. It creates a feedback loop where your body's natural responses become triggers for anxiety, which creates more physical tension, which makes pleasure more difficult, which reinforces the belief that something is wrong with you. Breaking that cycle requires understanding that your body isn't broken. Your pleasure response isn't faulty. What's happened is that you've been given false information about what's normal and what's healthy, and your body is responding to that misinformation as if it were true. One of the most powerful tools I have as a physician is simply telling women the truth about their bodies, not medical jargon, not complex terminology, just the straightforward truth. You're normal, you're healthy, you're allowed to feel good. The number of times I've watched women cry when I tell them this, when I normalize their experiences and validate their desires, tells me how rare these messages are. How many of us go through our entire lives never hearing from an authority figure that our pleasure matters, that our bodies are good, that our desires are acceptable. So let me be that voice for you now. Your pleasure matters. Your body is good. Your desires are acceptable. You are not too much. You are not too sexual. You are not too independent. You are not too anything. You are exactly as you should be. And if exploring your own pleasure, learning what brings you joy, connecting with your own body feels revolutionary, that's because it is. In a culture that has spent centuries trying to control women's bodies, claiming ownership of your own pleasure is a radical act. It's not selfish. It's liberation. I want to talk briefly about the role of touch in emotional regulation and overall well-being, because I think this is relevant to our broader conversation. Human beings need physical affection. We need touch that is nurturing, that is pleasurable, that reminds us we're safe and connected and alive. When we don't get that from others, we need to be able to provide it for ourselves. Self-pleasure is one form of nurturing touch. It's not the only form, obviously. Massage, warm baths, gentle stretching, all of these things matter. But sexual touch has unique benefits because of the neurochemical cascade it triggers. It's not just pleasant, it's regulatory. It helps your nervous system recalibrate. For women who are single, who are widowed, who are in relationships where physical affection is rare, maintaining a practice of pleasurable self-touch isn't just about sexual satisfaction. It's about meeting a basic human need for comfort and connection. And I want to be clear, I'm not suggesting that masturbation is a substitute for human connection or that anyone should resign themselves to solitude. What I'm saying is that your need for pleasure and comfort doesn't disappear just because you're not currently in a relationship. You don't cease to be a sexual being just because you don't have a partner. And you certainly don't need to wait for someone else's permission to feel good in your own body. Let me share one more story, and then I want to start bringing this together. I had a patient I'll call Elena who came to me at 62 with concerns about a rash she'd developed. As we talked, she revealed that she'd recently become sexually active again after 20 years of celibacy following her divorce. She was embarrassed, worried that something was wrong with her, convinced that her body was too old for this. The rash was simple contact dermatitis, easily treated, but what struck me was her shame. She apologized multiple times for bothering me with this, as if her sexuality were an imposition. She said she felt ridiculous, that people her age shouldn't still be thinking about these things. I asked her if she'd feel ridiculous seeking treatment for an injury from playing tennis or gardening. She said no, of course not. So why, I asked, should pursuing pleasure and intimacy be any less legitimate than pursuing any other activity that brings joy? She didn't have an answer, but I could see the question landed somewhere deep, because she'd never considered that those two things, her pleasure and her legitimacy, could coexist. She'd been operating under the assumption that her sexuality was something she should have outgrown, something embarrassing that she needed to hide. By the end of our conversation, her entire demeanor had changed. She sat up straighter. She stopped apologizing. She asked me directly about sexual health at her age, about what was normal, about how to navigate intimacy after so many years. These were excellent questions that she'd been too ashamed to ask until I gave her permission to be human. This is what medical care should be, not judgment, not shame. Just honest conversation about bodies and lives and the full spectrum of human experience, which includes sexuality at every age. As I start to bring this conversation toward a close, I want to summarize what we've covered, because I know it's been a lot. We started with a simple question. Does masturbation cause cancer? The answer is no. Definitively, unequivocally, scientifically, no. But we've gone much deeper than that because the real question underneath was about permission, about shame, about whether you're allowed to claim ownership of your own pleasure and your own body. Here's what I want you to take away from our time together. Your body was designed for pleasure, not as a frivolous add-on, but as a fundamental aspect of being alive. Sexual pleasure, whether experienced alone or with a partner, is healthy, normal, and beneficial for your physical and mental well-being. There is no credible scientific evidence linking masturbation to any form of cancer or disease. The shame you may have been carrying about your sexuality was taught to you. It's not inherent, and you can unlearn it. Women at every age, including and especially in midlife and beyond, deserve pleasure, intimacy, and joy. Taking time to connect with your own body, to understand what brings you pleasure, to honor your own needs is not selfish. It's foundational self-care. Pleasure is not something you need to earn. Safety and joy are your birthright. The stories you were told about your body being dangerous, too much, wrong, those stories were lies designed to keep you small and controllable. You can reject them. Your sexual autonomy, your right to experience pleasure on your own terms, is non-negotiable. No partner, no family member, no religious authority, no cultural norm has the right to take that from you. And perhaps most importantly, making peace with your sexuality is part of making peace with yourself. You can't fully inhabit your own life while at war with your body. You can't experience authentic joy while carrying shame about something as fundamental as pleasure. So here's my challenge for you this week. I want you to do something that might feel uncomfortable at first. I want you to look at yourself in the mirror, really look, and say out loud, "My body is good, my pleasure matters, I am allowed to feel good." Say it even if you don't believe it yet. Say it especially if it makes you uncomfortable. Say it until it starts to sound less like a radical declaration and more like simple truth. And if you're ready to go deeper, I want you to think about one small way you can honor your body this week. Not as a chore, not as something you should do, but as an act of kindness toward yourself. Maybe it's taking a bath without rushing. Maybe it's saying no to a demand on your time so you can have an evening to yourself. Maybe it's exploring what feels good without judgment or expectation. You don't have to share the details of what you choose. This is yours, private, sacred. But I do want you to notice how it feels to prioritize your own comfort and pleasure, even in a small way. Notice what resistance comes up. Notice what fears or judgments arise. And notice, too, what happens when you do it anyway. Because here's what I've learned in 15 years of clinical practice. Healing begins the moment you stop treating yourself like an enemy and start treating yourself like someone worthy of care. And you are worthy. Not because of what you do for others, not because of how well you perform, not because you've earned it, simply because you exist. Your pleasure is not frivolous. Your comfort is not selfish. Your joy is not negotiable. These are facts as fundamental as any medical diagnosis I could give you. So I want you to subscribe to this channel if you haven't already, because we're going to keep having these conversations. We're going to keep talking about the things that matter, the things that are too often whispered about or ignored entirely. Women's health, emotional well-being, sexuality, aging, all of it deserves to be discussed with the honesty and respect we bring to any other aspect of human experience. Leave me a comment telling me what resonated with you, what surprised you, what you're still struggling with. This community is built on honest conversation, and your voice matters here. Share this video with another woman who needs to hear this message. I guarantee you know someone who's been carrying shame about her body, her desires, her right to feel good. Send this to her, not as judgment, not to fix her, but as an offering, as a way of saying, you're not alone in this. And tell me in the comments, what's one thing you've been taught about your body that you're ready to unlearn? What's one lie you're ready to let go of? Write it down. Naming it is the first step to releasing it. I'm Dr. Valeria Montes, and I believe in treating women with the honesty and dignity we deserve. I believe in calling out shame wherever it hides. I believe in reclaiming pleasure as a birthright, not a privilege. And I believe that when we stop apologizing for taking up space in our own lives, we become unstoppable. Thank you for trusting me with your time, your attention, and your stories. I'll see you in the next video, where we'll continue this important work of learning to live in our bodies with joy, authenticity, and absolutely zero apology. Until then, be kind to yourself. You're doing better than you think.